Migraine sufferers, there's some good news out there for prevention of migraine headaches. I've been treating persons of all ages for over 30 years, and I've treated a lot of migraine headaches. And I know from personal experience that sufferers of migraine headaches are endlessly seeking for something to prevent these things, especially people with chronic migraines, people who have 15 or more episodes of migraine headache in a month's period of time. Classic migraine comes rushing in with its auditory and visual hallucination, and about the only thing to do as it invades is to retreat to a dark room and rest. Certainly there are some medications to be taken at the onset of the headache, but if you get behind a little bit, they may not work. So this is really a big issue. The annual cost of migraine headaches reaches $78 billion annually. Can you believe that? And again, there's this endless search for something that will reduce the intensity, the severity, and prevent migraine headaches altogether. Make them go away. Make them so they never happen. Make them so they do not interfere with personal, professional, and recreational life. There's lots of ways that migraine sufferers approach this problem. First of all, they avoid triggers, don't they? If you have migraine headaches, you know that certain smells, certain lights, certain foods may trigger a migraine headache. It's also clear from research that chronic pain is often connected with adverse childhood and adverse adult experiences. If you're holding the burden of adverse childhood and adult experiences in, CBT, or cognitive behavioral therapy, also known as counseling, may be one way to reduce the incidence, severity of migraine headaches and perhaps even prevent them altogether. So don't leave that out as an important modality in addressing migraine headaches. Believe it or not, Excedrin migraine has been approved by the FDA and is beneficial for many individuals. So an inexpensive over-the-counter medication taken immediately at the onset of the first signal of a migraine, like Excedrin migraine, may be enough to stop the migraine before it gets out of control. We've used propranolol for years to modify the frequency of migraine headaches and to prevent them, and it's been pretty effective, but fortunately there are newer medications online that perhaps work better, but if you haven't used propranolol, it's worth a try. If depression is a component of your migraine headaches or migraine headaches of individuals you know, the medication Cymbalta has been shown to reduce the intensity, the severity, and the frequency of migraine headache. So used in conjunction with counseling or cognitive behavioral therapy, Cymbalta may be the trick in effectively treating your migraine headaches. We also use Imitrex. I've used a lot of Imitrex. It's been very beneficial. It's been around now for 15 or maybe even 20 years. Imitrex, injection or oral form, an effective way to treat migraines. Botox injections, although they are very expensive, have been shown to be beneficial through research, and many people have had success with that. But here's the good news. A new class of medication called CGRP inhibitors have been shown in research to be very effective in some individuals in preventing migraine headaches. Goes by the brand name Aimovig, and it is very effective for some individuals in treating migraines. Not everyone, not the answer in the be-all. The actual effectiveness is still out there some, but for many individuals in research study, it has been very effective. These CGRP inhibitors, which one goes by the brand name Aimovig. So this is Dr. Jim for Be Healthy, Be Happy. That's the good news, migraineurs, and I hope it's effective for you. Oh, I forgot to tell you, it's $7,000 a year, enough to give a headache to anyone. So if you can't afford that, try some of the other things and keep working on this. I wish you luck with it. I know it's really a burden. Power your path to happiness. This is Dr. Jim. Subscribe to Be Healthy, Be Happy with Dr. Jim on YouTube, and take good care of yourself.